We're here talking today with Andrew Morton, CEO of Bloom Health Partners. It touched upon real briefly, Andrew, about decision-making and authority of CMOs. Because in the hospital, most of these positions are, they're filled by doctors, physicians who are very well trained. Most of them have gone back and got their MBAs. So, all right, you got a foot in both the medical and the business world, but they're figureheads. They're there to, keep the workforce motivated and make sure that the doctors don't quit or kill themselves. And they're taking orders from, administration who have no care decisions whatsoever. And one of my favorite things to ask CMOs in hospital and healthcare settings is, what do you do? And then they tell me exactly what I just said. And I go, that's interesting. How do you define quality? How do you define quality of care? And the honest ones will sit there and laugh and say, it's whatever the insurance companies and Medicare tell me it is. Within this conversation, what we're talking about here, I'm thinking like the CMO is completely unshackled. They can go be basically, making medical decisions for a whole host of people who are very pivotal and very important for the company. Am I correct in thinking that now you can free their medical mind to do what's right?
Well, exactly. I think a CMO, because they're C-level, especially in a public company, becomes a part of compliance. And there's a couple of different dimensions to this. At the very least, a good CEO will know you can't turn to your CFOs and say, okay, I need you to make the numbers look like this. They are what they are. Otherwise, that's illegal. Okay. That's compliance, right? A good CMO should be able to say to a good CEO, hey, these are the things we need to do for our company, or next year's not going to be all that pretty because we're going to have a lot of sick people on our hands. Flu season's coming, or the next pandemic, heaven forbid, is coming. Or at the very least, we have a lot of very unhealthy people here that are borderline type 2 diabetes. We need to do something about our vending machines today. Those are the kinds of things that a good CMO can do. And it's about compliance. And a good CEO will know that when they turn to the CMO and they're being told, here's what we need to do here to run the organization correctly, they'll listen. They definitely have, CIOs definitely have the ear of the CEO, and as do CFOs for very obvious reasons. Why not somebody thinking about the health and welfare of the employees too? And for the CEO, especially if they're public, they now have a checkpoint for compliance where they can say to shareholders, we have 30,000 or 10,000, whatever it happens to be, machinists and factory workers and back office professionals and all of that. And we feel very confident that we have a healthy, viable workforce that's satisfied. That becomes a really valuable thing for a company that's looking to attract and produce shareholder value.